Have you ever experienced discomfort in your feet, legs, or knees? You're not alone. Millions across the globe suffer from painful walking, nighttime cramping, swollen extremities, tingling sensations, and heaviness without realizing their blood. Vessels are the actual culprits behind these issues. Healthy circulation is absolutely essential for your entire body to function optimally. When this intricate system begins to falter, it frequently manifests as varicose veins, those dilated vessels that underperform, alongside hardened and obstructed arteries in your neck, heart, and lower limbs, a condition healthcare professionals identify as atherosclerosis. Beyond these commonly recognized symptoms, compromised circulation can significantly delay wound healing, weaken leg muscles, and exacerbate existing conditions like neuropathy, triggering burning sensations and painful tingling throughout your feet. What's particularly concerning is that when circulatory problems emerge, blood can become stagnant and thicken, especially in your legs. This stagnation potentially leads to dangerous clot formation or thrombi in both veins and arteries, further disrupting blood flow and potentially creating serious health complications. The remarkable news: you can naturally enhance your circulation using home remedies likely already sitting in your kitchen pantry. Today, I'm excited to introduce you to 4 vital vitamins that promote heart health and circulation, helping your blood flow harmoniously while reducing clot formation. Pay particular attention to the last 2 vitamins. They're incredibly powerful for vascular health. It's crucial to understand that circulatory issues often develop gradually, silently progressing without obvious warning signs initially. While anyone can develop these problems, they're significantly more prevalent among older individuals, those with heart conditions, hypertension, diabetes, or smokers. Managing these underlying conditions is therefore essential for improving circulation as part of a comprehensive treatment approach. Be vigilant for 5 warning signs indicating your circulation problems might be more serious than you realize. If you notice any of these symptoms while incorporating the natural remedies I'll share, please seek medical attention promptly. In such cases, imaging tests like ultrasound combined with clinical evaluation can help address the issue early, preventing potentially life-threatening complications. The first warning sign is persistent numbness or tingling, an uncomfortable, prickling sensation in your legs and feet that appears frequently, especially after sitting for extended periods, crossing your legs, or standing for hours. If this happens regularly, it's concerning because your muscles and nerves might not be receiving sufficient oxygen. The second red flag involves constantly cold feet, even during hot weather, which strongly suggests poor circulation to your extremities. The third warning sign manifests as leg cramps during walking or exercise that are so intense they force you to stop whatever you're doing. This occurs because your muscles aren't receiving adequate oxygen and nutrients during physical activity. Medical professionals call this condition intermittent claudication, a clear indicator that circulation to your legs is compromised. These cramps often intensify at night, compelling you to jump out of bed or massage the affected area for relief. Some individuals experience restless legs instead of cramps, a frustrating sensation where finding a comfortable position becomes impossible, disrupting sleep and drastically affecting quality of life. If you've felt this discomfort, it suggests circulatory problems are already affecting your nerves or worsening any existing neuropathy, requiring immediate attention. I want to emphasize that these conditions are treatable and often reversible, especially when incorporating the natural remedies I'll discuss shortly. The fourth warning sign involves skin color changes, becoming paler, purple with a bluish tint, or developing dark brown patches, particularly around the feet and ankles. These discolorations reflect damaged blood vessels that not only affect appearance, but can cause wounds to heal slowly and legs to swell easily. The fifth warning sign presents as varicose veins and spider veins, dilated, twisted vessels visible beneath the skin with a reddish or bluish coloration. This typically occurs when vein walls weaken or their valves malfunction, causing blood to flow in unnatural directions or stagnate, triggering all previously mentioned symptoms. All these signs indicate your circulation urgently needs attention, at minimum to rule out advanced issues and begin treatment immediately. Let's now explore 4 essential vitamins to enhance circulation and strengthen both veins and arteries. First is niacin, also known as vitamin B3, a crucial nutrient renowned for its positive effects on circulatory health. This vitamin works to maintain flexibility and strength in blood vessels, helping prevent blockages, reducing blood clot formation, and improving overall blood flow. These benefits are particularly valuable for individuals suffering from varicose veins or venous insufficiency. Beyond improving circulation, niacin plays a vital role in heart health by regulating cholesterol levels, reducing low-density lipoprotein, LDL, or bad cholesterol, while increasing high-density lipoprotein, HDL, or good cholesterol. This regulation is fundamental for preventing plaque formation and keeping arteries clean and open for optimal blood flow. When cholesterol plaques accumulate, they harden and narrow blood vessels, restricting blood passage and increasing risks of serious health complications, including heart attacks, strokes, and circulatory disorders in your legs. Maintaining appropriate niacin level prevents this damage while simultaneously protecting your heart. Niacin's benefits extend significantly beyond cardiovascular health. In the brain, it protects neurons from age-related damage, enhancing memory and concentration while promoting healthier aging processes. But how can you effectively obtain this vitamin? Niacin naturally occurs in various foods, probably already in your kitchen. Eggs provide an accessible source easily incorporated into breakfast. Chicken breast, particularly when hormone-free, stands out as a low-fat, niacin-rich protein. Regarding seafood, salmon and tuna offer excellent options not only for their niacin content but also for providing additional nutrients like vitamin D and healthy fatty acids. Finally, nuts such as almonds provide a practical snack option between meals. Daily niacin requirements vary among individuals, but average adults typically need between 14–16 mg daily, an amount easily obtained through a balanced diet. For instance, a 100-gram chicken breast contains more than half your daily niacin requirement, a supplement truly necessary. In most cases, supplementation isn't required if your diet already includes these foods. However, specific conditions like nutritional deficiencies, chronic alcoholism, or certain intestinal diseases involving malabsorption might benefit from supplements. One important caveat: excessive supplemental niacin can cause niacin flush, a phenomenon manifesting as redness, warmth, and generalized itching. While generally not dangerous, it's quite uncomfortable. Let's move on to another crucial vitamin for blood vessel health. Vitamin C, also known as ascorbic acid. Understanding its medicinal properties is vital. This potent antioxidant directly affects your blood vessels by strengthening their walls and helping maintain flexibility and resilience. This keeps the pathways where blood circulates strong and healthy, resisting age-related damage. Beyond these positive effects, vitamin C serves an essential function in collagen production, a protein acting as natural support for artery and vein walls. This reinforcement is crucial because it strengthens these vessels' structure. When collagen remains healthy, the risk of developing varicose veins and other circulatory problems caused by vascular wall deterioration decreases significantly. These effects become even more important in the legs, where blood vessels endure greater pressure due to gravity and distance from the heart. Consequently, Adequate vitamin C improves circulation in both legs and feet while reducing inflammation. In these areas, particularly beneficial for those suffering from restless leg syndrome or sensations of tired, heavy legs at day's end. What are the best sources of this powerful vitamin? Fresh citrus fruits like oranges and lemons, as well as kiwis and strawberries, rank among the primary sources. Ideally, consume these foods as fresh as possible, since vitamin C rapidly degrades upon contact with air and light, diminishing its effectiveness. If you store cut fruits for extended periods, they lose potency. Interestingly, many people don't realize that guava contains more vitamin C than an orange. Additionally, this vitamin appears in vegetables like broccoli, red peppers, and spinach. Pay careful attention now. Although vitamin C supplements are widely available, it's critically important not to exceed 2,000 mg daily, as this may cause digestive discomfort and increase kidney stone risk. Therefore, always prioritize natural sources that provide this vitamin safely and effectively. Supplements should only be considered under specific circumstances and with medical prescription. Now that we understand the fundamental roles of niacin and vitamin C in circulation, let's discuss another key nutrient, vitamin K. This vitamin is essential for protecting the circulatory system and preventing clot formation, allowing blood to flow optimally toward the extremities, thus improving both venous and arterial health. Its primary function involves regulating blood coagulation in a highly controlled manner, preventing both hemorrhages and dangerous clot formation. Furthermore, vitamin K plays a crucial role in preventing calcium development, the condition that reduces blood flow and increases risk of serious health problems like heart attacks and strokes. To obtain it naturally, green leafy vegetables like broccoli, spinach, and kale offer excellent options. These foods not only provide vitamin K, but also antioxidant and anti-inflammatory substances that protect all your cells, along with fiber that benefits intestinal microbiota. Additionally, kiwis contain vitamin K and easily integrate into your diet. I recommend preparing a daily green juice rich in antioxidants, potassium, magnesium, and vitamin K made with celery, kale leaves, 1 kiwi or red apple for sweetness, a piece of ginger, and some mint leaves for freshness. If you prefer additional sweetness, a teaspoon of cinnamon makes an excellent choice. Drink 1 glass each morning without filtering. An important caution: if you're taking anticoagulants like warfarin, you don't need to reduce vitamin K-rich foods. The issue isn't consuming them, but making sudden changes in consumption. Your physician adjusts your anticoagulant dosage during consultations to maintain stable effects in your body, which depends on steady vitamin K levels. Therefore, if you eat substantial broccoli one day but no vegetables the next, this fluctuation might alter your medication's effectiveness, making it either less effective or excessively potent. Ideally, maintain consistent vegetable quantities in your diet, consuming them regularly and in balanced amounts. If you decide to increase or decrease consumption for any reason, consult your doctor beforehand to adjust medication dosage and avoid complications. Finally, we reach one of the most powerful vitamins for circulatory health, vitamin E. This nutrient is renowned for its antioxidant properties that help protect our cells from daily wear. To better understand, imagine your blood vessels as water pipes that can oxidize and weaken over time, especially when continuously exposed to harmful substances. Free radicals represent exactly these harmful substances, tiny particles circulating through your body that, if uncontrolled, can oxidize and weaken blood vessel walls. Vitamin E functions as a protective shield, preventing these free radicals from causing damage. Consequently, your arteries and veins remain strong and flexible, allowing better blood flow and reducing risk of diseases affecting your heart, brain, and legs. Additionally, this vitamin is essential for preventing clot formation, which significantly reduces the risk of circulatory obstructions. But its benefits don't end there. Vitamin E stimulates nitric oxide production, a molecule causing relaxation and dilation of our vessels. This process, called vasodilation, facilitates blood passage and reduces blood pressure, allowing your heart to work more efficiently. To obtain these benefits, foods like pasture-raised egg yolks, almonds, pumpkin or sunflower seeds, and vegetables such as spinach and broccoli are rich in vitamin E. Additionally, avocados provide a natural source, especially when you scrape the darker pulp in contact with the peel. Many don't realize that extra virgin olive oil, besides containing beneficial fats, also provides vitamin E. Regarding supplements, I believe they're unnecessary unless your doctor prescribes them for specific reasons like malabsorption due to intestinal problems or confirmed vitamin E deficiency. In fact, high-dose or uncontrolled supplements increase complication risks such as hemorrhages. Conversely, just one serving of almonds, 30 g equivalent to a small handful, covers approximately 50% of the recommended daily allowance. When complemented with a diet rich in green leafy vegetables and healthy oils, the vitamin E levels you'll obtain are more than sufficient to protect circulatory system health without requiring additional supplements. Remember, taking care of your circulation is an investment in your overall health. By incorporating these vitamins into your daily routine through natural food sources, you're taking a powerful step toward better vascular health and improved quality of life. Start these changes today, and your body will thank you tomorrow with better energy, reduced discomfort, and a stronger cardiovascular system for years to come.